As a brain doctor, I need you to pay close attention to what I am about to share. Stroke is one of the most serious medical emergencies we face, and it often strikes without warning. Yet the truth is that many strokes do not come entirely out of nowhere. In fact, research shows that nearly half of all patients experience small warning episodes in the days or even weeks before a major attack. These can appear as sudden dizziness, numbness in the face or limbs, slurred speech, or a severe headache that seems to arrive without reason. Too often, people dismiss these signals because they fade quickly. They think the problem has passed. But what is really happening is that the brain is sending urgent alarms that blood flow is unstable. A mini stroke, also called a transient ischemic attack, may last only a few minutes, but it is a direct warning that a larger and more damaging stroke could occur soon. Recognizing these subtle signs can save your life or the life of someone you love. The danger is real, but so is the opportunity to act early, get medical care, and prevent permanent disability. Stroke can rob you of speech, movement, memory, and independence in seconds. But quick recognition can give you a chance to recover fully. In this video, I will guide you through the hidden symptoms, the proven ways to recognize them using the FAST rule, and the steps you can take to protect yourself before it is too late. Before we begin, I want to hear from you. Have you or someone you know ever experienced sudden dizziness, weakness, or slurred speech that disappeared quickly? Share your story in the comments, because your experience might help someone else recognize the danger in time and seek help before tragedy strikes. 1. Can stroke be detected early? Many people believe that stroke always comes like a bolt of lightning, sudden and unstoppable. While it is true that strokes strike quickly, the body often gives early warnings that can and should be recognized. In fact, studies reveal that about 40% of patients experience a transient ischemic attack, often called a mini stroke, within a week before a major event. These mini strokes may seem minor because the symptoms disappear within minutes, but they are not harmless. They are critical alarms that blood supply to the brain is unstable and that a major stroke could follow soon. Recognizing these signs early can make the difference between life and death. The symptoms of a transient ischemic attack mimic those of a full stroke. A person may suddenly feel numbness or tingling in the face, arm, or leg, usually on one side of the body. They may notice weakness, difficulty holding objects, or an arm that simply will not lift as it should. Speech can also be affected. Words may come out slurred, or the person may struggle to say even simple sentences. Vision problems are another common warning. Temporary blurriness, double vision, or sudden loss of sight in one eye can occur. Severe headaches, dizziness, and loss of balance may also appear without clear reason. Because these episodes often last only a few minutes, many people ignore them, hoping they will not return. This is a dangerous mistake. Every mini stroke is a direct signal that a larger stroke is on the horizon, sometimes within days. The key to detecting stroke early is not only recognizing symptoms, but also acting immediately. When a transient ischemic attack occurs, the brain is essentially telling you that its blood vessels are in crisis. If you wait and do nothing, the risk of a full stroke rises dramatically. If you respond quickly, get medical evaluation, and address the underlying problems such as high blood pressure, diabetes, or cholesterol, you may prevent a devastating event. Doctors use the FAST rule to help people identify the early signs. F stands for face, asking whether one side droops when the person smiles. A stands for arm, checking if one arm drifts downward when both are raised. S stands for speech, noticing whether words are slurred or sentences are difficult to repeat. T stands for time, emphasizing that every second counts, and emergency help must be called without delay. FAST is simple, but it saves lives. So can stroke be detected early? The answer is yes. If we are willing to listen to our bodies and respond to subtle clues, many strokes are not small problems. They are red flags. Ignoring them can mean the loss of independence, mobility, or even life itself. Taking them seriously gives you the chance to seek treatment, stabilize your health, and prevent the tragedy of a major stroke. Stroke is urgent, but it is not always silent. Early detection is possible, and it begins with awareness, vigilance, and swift action. 2. Early warning signs you must not ignore. The human brain is a delicate organ, and when its blood supply is threatened, it often cries out with signals that demand attention. These warning signs may appear suddenly, vanish within minutes, and then return again later. Too many people dismiss them as fatigue, stress, or just a passing spell. But doing so can cost precious time. Recognizing and acting on these early signs is one of the most effective ways to prevent severe damage from stroke. One of the clearest warning signs is weakness or numbness on one side of the body. A smile may look uneven, the mouth may droop, or an eye may not open fully. Arms and legs may suddenly feel heavy or unresponsive, making it impossible to lift both arms at the same time. This weakness does not have to be complete paralysis. Even mild tingling or loss of coordination should raise alarm. These are signs that blood flow to part of the brain is impaired. Another critical signal is speech disturbance. A person may suddenly slur words, mix up simple phrases, or find themselves unable to speak at all. Sometimes they can hear others clearly but cannot form a clear response. Asking them to repeat a simple sentence is a fast way to test this. If the words come out garbled or incomplete, treat it as an emergency. Language difficulties reflect damage to areas of the brain responsible for communication, and delay in treatment can make recovery much harder. Vision changes also provide important warnings. A sudden loss of sight in one eye, double vision, or blurred vision that comes on quickly should never be ignored. Even if it clears within minutes, it indicates that circulation to the brain or optic pathways has been disrupted. Many people dismiss temporary vision problems as eye strain, but in reality, they may be early signs of a stroke in progress. Sudden loss of balance or coordination is another red flag. A person may stumble, feel dizzy, or be unable to walk straight. These changes are not simply signs of aging. They may signal that the brain cerebellum, the part responsible for balance, is being deprived of blood. Accompanying symptoms such as nausea, vomiting, or difficulty standing should raise even greater concern. A severe headache unlike any before is perhaps the most dramatic sign. When a blood vessel bursts and bleeding begins inside the brain, the pain is often described as explosive, reaching maximum intensity in seconds. This is sometimes called a thunderclap headache. It may also come with vomiting or altered consciousness. Any sudden headache that feels different, especially in an older adult, should prompt immediate medical evaluation. These symptoms together form the basis of the FAST rule: face drooping, arm weakness, speech difficulty, and time to call emergency services. But beyond FAST, there are additional signs such as sudden confusion, memory problems, or difficulty understanding information. Each one is a potential cry for help from the brain. The danger is that these signs may last only a few minutes, leading people to believe they are safe. In truth, every brief episode is like a rehearsal for a major stroke. Ignoring them is like ignoring smoke before a fire erupts. Taking them seriously, calling emergency services, and getting immediate care can mean the difference between returning to normal life or living with permanent disability. 3. How many days in advance can stroke symptoms appear? One of the most important questions patients and families ask me is whether stroke can be predicted in advance. While no doctor can say with certainty exactly when a stroke will occur, research and clinical experience show that the body often provides warnings hours, days, or even weeks before a major attack. Recognizing these early clues may be the only chance to prevent irreversible brain damage. In many cases, warning signs appear just one day before a stroke. A person may notice their face drooping on one side, sudden weakness in an arm or leg, or difficulty speaking clearly. These changes may happen briefly and then disappear, but they should never be dismissed. When such symptoms occur, it is already a signal that blood supply to the brain is unstable, and a full stroke may strike within hours. Immediate medical attention is essential in these cases, because early treatment can dissolve clots, restore circulation, and prevent permanent disability. Sometimes, stroke symptoms appear as early as a week before the event. These are often episodes of transient ischemic attacks, or mini-strokes. A person may experience temporary numbness, vision loss, dizziness, or slurred speech that resolves within minutes. These episodes may occur once or repeat several times during the week. Although they seem to pass without harm, they are clear warnings. Studies show that nearly half of patients who experience a mini-stroke will go on to have a major stroke within days. This is why urgent evaluation and treatment after even a single episode is critical. In rare cases, early signs may appear up to 30 days before a stroke. These symptoms are often subtle, such as unusual fatigue, mild headaches, brief dizziness, or slight vision changes, because they are non-specific. Many people attribute them to stress, aging, or lack of sleep. Unfortunately, ignoring them can mean missing the opportunity to identify conditions like uncontrolled hypertension, high cholesterol, or arrhythmias that are quietly setting the stage for a devastating stroke. A sudden increase in the frequency or intensity of headaches, unexplained balance issues, or repeated episodes of confusion should always raise concern. What makes stroke so dangerous is not only the speed with which it strikes, but also the unpredictability of its timing. A person may feel fine one moment and be unable to move or speak the next. Yet the evidence is clear that early signs are common. They may appear a day before, a week before, or even longer in advance. The real danger is failing to connect these dots and seek medical help. The lesson is simple. If you or someone you know experiences sudden neurological changes, even if they last only a few minutes, do not wait. Do not assume the problem will resolve on its own. Seek emergency care immediately. Doctors can perform tests to identify blockages, weak blood vessels, or irregular heart rhythms that increase stroke risk. With timely intervention, medication, and lifestyle changes. A full stroke can often be prevented. Stroke is not always silent. The body whispers warnings in advance, sometimes softly, sometimes loudly. Listening to those whispers, taking them seriously, and acting without delay is the key to saving brain cells, preserving independence, and protecting life itself. 4. Risk factors that make stroke more likely. Understanding the risk factors for stroke is one of the most important steps in prevention. A stroke rarely happens out of pure chance. It is almost always the result of conditions, habits, and long-term stresses on the body that gradually weaken blood vessels and disturb the flow of blood to the brain. Some of these factors are beyond your control, but many can be managed or changed if you take action early. The first set of risks comes from your own biology. Age is a major factor, as the likelihood of stroke doubles every decade after 55. Blood vessels naturally stiffen with time, making them more vulnerable to blockage or rupture. Gender also plays a role. Men are more likely to experience strokes earlier in life, while women, especially those beyond menopause, face increased complications and a higher chance of death from stroke. Family history is another important factor. If a parent or sibling has suffered a stroke, your risk rises because genetic traits affecting blood pressure, cholesterol, or vessel strength are often shared. Ethnicity must also be considered, as African American individuals are nearly twice as likely as white individuals to suffer stroke, in part because of higher rates of hypertension and diabetes. The second set of risks comes from health conditions that place constant pressure on your cardiovascular system. High blood pressure is the most powerful driver of stroke, damaging artery walls and setting the stage for both clots and ruptures. Diabetes adds to the danger by harming small vessels and altering the way the body uses sugar, which in turn makes blood thicker and more prone to clot. Heart disease, including atrial fibrillation, creates irregular rhythms that allow blood to pool and form clots that can travel directly to the brain. High cholesterol builds fatty plaques inside arteries, narrowing the space for blood to pass through. Obesity intensifies nearly all these risks by raising blood pressure, cholesterol, and blood sugar at the same time. The third set of risks comes from lifestyle choices that silently erode vessel health. Smoking nearly doubles the risk of stroke. Each inhalation bathes the arteries in toxins, speeds the hardening process, and increases clotting. Even exposure to secondhand smoke damages blood vessels. Excessive alcohol consumption is another hidden danger. It raises blood pressure, weakens the heart, and contributes to irregular rhythms. Prolonged use of oral contraceptives or postmenopausal hormone therapy can also raise the risk of clot formation, especially when combined with smoking or high blood pressure. A sedentary lifestyle compounds the problem. Lack of physical activity encourages weight gain, raises cholesterol, and weakens the heart, while chronic stress bathes the body in hormones that constrict blood vessels and keep blood pressure elevated. Taken together, these factors form a network of pressures that eventually overwhelm the brain's blood supply. The encouraging truth is that while you cannot change your age or genetics, you can dramatically lower risk by addressing the health conditions and lifestyle habits under your control. Managing blood pressure, controlling diabetes, treating heart disease, quitting smoking, limiting alcohol, maintaining a healthy weight, and exercising regularly can cut your risk of stroke in half. Stroke does not arrive without reason. It is the predictable outcome of risks left unmanaged. By understanding these factors and taking steps to address them, you are not only lowering your numbers on a chart, you are actively protecting your independence, your memory, and your future. Every risk factor reduced is another step away from stroke and another step toward a longer, healthier life. 5. How to prevent stroke effectively. The most powerful message I can give you about stroke is this: it can often be prevented. While no one can erase every risk, most strokes result from conditions and habits that can be managed or changed. Prevention is not only possible, it is essential if you wish to protect your brain, your independence, and your quality of life. Effective prevention begins with nutrition. A balanced diet rich in vegetables, fruits, whole grains, legumes, and lean sources of protein gives the body the building blocks it needs to keep blood vessels strong. Foods like salmon, walnuts, and flaxseed provide omega-3 fatty acids that reduce inflammation and keep arteries flexible. By contrast, diets heavy in processed foods, sugar, red meat, and fried dishes increase cholesterol and raise blood pressure and clog arteries. Limiting salt intake is especially important because high sodium drives blood pressure higher, and elevated blood pressure is the single greatest contributor to stroke. Hydration also matters. Drinking water instead of sugary or alcoholic drinks supports circulation and helps maintain a healthy weight. Exercise is another cornerstone of prevention. You do not need to run marathons to protect your brain. 30 minutes of brisk walking, swimming, cycling, or even dancing most days of the week is enough to lower blood pressure, improve heart function, and keep blood flowing smoothly. Strength training and balance exercises also protect older adults from falls and maintain muscle health, which indirectly supports brain health. The key is consistency. Activity should be part of daily life, not an occasional effort. Weight control is critical because obesity magnifies nearly every stroke risk. Excess weight increases blood pressure, cholesterol, and diabetes risk all at once. Monitoring your body mass index and waist circumference, and adjusting diet and activity to keep them in a healthy range can drastically reduce stroke risk. Managing chronic conditions is equally vital. If you have diabetes, hypertension, or heart disease, follow your doctor's instructions carefully. Take medications as prescribed. Monitor your blood sugar and blood pressure regularly, and attend checkups without delay. These steps allow early detection of problems before they progress into a crisis. People who ignore these conditions or fail to take medications consistently put themselves at much higher risk of stroke. Lifestyle choices also play a central role. Smoking should be stopped completely. Every cigarette damages blood vessels and increases clotting risk. Quitting at any age begins to repair the body and lower stroke risk within weeks. Alcohol should be limited to modest amounts or avoided entirely. Recreational drugs and stimulants should be eliminated, as they directly damage the heart and arteries. Mental health cannot be overlooked. Chronic stress raises blood pressure and weakens vessel health. Finding ways to relax, such as meditation, deep breathing, spending time in nature, or enjoying music and reading, lowers stress hormones and supports vascular health. Staying socially connected is equally important. Loneliness and isolation increase depression and unhealthy behaviors, while social activities improve both mood and physical health. Finally, schedule regular health screenings. Many of the conditions that cause stroke progress silently. blood pressure, cholesterol, and blood sugar should be checked often, especially if you have a family history of stroke or other risk factors. Preventive care is not optional. It is the safety net that catches problems early and provides treatment before they result in a catastrophic event. Preventing stroke is not about perfection. It is about persistence. Small choices made consistently over time build strong defenses. Each healthy meal, each walk, each checkup, and each moment spent reducing stress adds to your protection. Stroke prevention is a lifelong commitment, but it is one that rewards you with clarity, independence, and more years to spend with the people you love. Doctor's final words. As a brain doctor, my final message to you is clear. Stroke is not a random tragedy that strikes without reason. It is the result of risks and habits that build silently over years, until one day the brain can no longer endure. The frightening reality is that stroke can rob you of movement, speech, in memory, and independence in a matter of seconds. But the hopeful truth is that many strokes can be prevented if you act before it is too late. Early warning signs such as sudden numbness, slurred speech, or brief vision loss should never be ignored. Even if they pass quickly, they are cries for help from your brain. Recognize them, take them seriously, and seek medical care immediately. Time lost is brain lost, and every minute counts. Prevention is not about fear. It is about empowerment. By eating wisely, moving daily, managing weight, quitting smoking, limiting alcohol, and controlling conditions like high blood pressure and diabetes, you build a shield around your brain. By reducing stress, staying socially connected, and scheduling regular health checkups, you give yourself the best chance to remain strong, clear, and independent. I encourage you to reflect honestly on your daily routines and make changes now. Share your thoughts and experiences in the comments, because your story may guide someone else to recognize the danger in time. Remember, stroke prevention is not about perfection. It is about persistence. Each step you take toward healthier living is another step away from stroke. Do not wait until a crisis takes away your choice. Begin today. Protect your brain. Safeguard your independence. And give yourself the gift of more years with dignity and strength. The decision is in your hands.